think it's definitely come out of the woodwork more. I think we were probably better at masking it before.
Yeah.
You know, the pace of life was so rapid and is so rapid all of the time. The way that we are constantly moving from one activity to another, never able to sit still. Whereas COVID forced us to sit still. And sometimes when you're confronted with no distractions and you're actually able to kind of sit with yourself, you start to notice things within yourself that perhaps you didn't have time to notice before.
Oh, yeah.
But also our relationships changed. The makeup of families changed. You know, I witnessed quite a lot of family breakdowns because they were never kind of completely with each other. So they hadn't realised, actually, I don't really like this person anymore. You know, that person doesn't serve me and we're not serving each other in the way that we were 20 years ago or whatever.
Yeah.
And I think that COVID opened that kind of worms that, you know, we'd just been kind of shoving under the carpet a little bit before. So I don't think that there are necessarily more children with mental health concerns than there were before, but I think it's more that we're able to notice them. Some children who had been squashing certain feelings weren't able to squash that anymore.
Yeah. So COVID gave time.
Definitely.
Yeah.
And it's definitely something that I noticed on the return to the classroom. Those children who you would never have really noticed as having had an issue before because they were just so good at masking, that mask had slipped because they didn't have to, because they'd spent so long in a zone where they were perhaps comfortable, surrounded by their family and you know, their very close family. They no longer knew how to put that mask back on. So that's what we're noticing, I think.
Yeah. So when we talk about mindfulness, this is what a conversation I really enjoy having. We've had it a few times now.
Take